In today's video, we're going to talk about peroneal tendinopathy. And peroneal tendinopathy is generally characterized by pain on the outside part of the foot, heel area. And we tend to see this in people more so as a compensatory type of injury, meaning that they have something else going on that's leading to some overuse or some overloading of those tendons of the peroneal muscles. One of the conditions that often mimics this type of injury is Achilles tendonitis. And we went through a full evaluation and treatment protocol for Achilles tendonitis, tendinopathy, and I'll put a link to that video up in the corner here so you can check that out, so you can see what the differences are between the two types of conditions. But in general, like I said, this is an injury that we see with some compensation. A typical presentation is a patient that may have something like plantar fasciitis, and they're avoiding going through their inner part of their foot or heel area because of the pain due to plantar fasciitis, which then starts overloading the outside musculature where the peroneal muscles lie.
So as Travis said, we see this a lot as a secondary condition or compensatory issue. So yeah, with plantar fasciitis, sometimes people land on the outside of their foot or just be limping because of the pain, and the repetitive strain on the outside of the foot leads to this issue. Another common thing we'll see is after an ankle injury. So people roll their ankle, have an ankle sprain, and then as they're recovering, they might be in a boot or an ankle brace. With that, their foot stays in a position that's a little bit more rigid, tend to land on their heel or outside of their foot more. That repetitive stress can lead to peroneal issues, or just by being in a brace, you don't get to fully flex your foot as far, and that can lead to some issues with the peroneal tendons. We'll also see this sometimes even with orthotic use. So a lot of times people get orthotics for different conditions like plantar fasciitis, and especially if it's a very stiff or hard orthotic, sometimes that can limit how you move through the outside of your foot, and over time lead to a peroneal issue. Sometimes we'll also see something called cuboid syndrome associated with peroneal issues, where the peroneal tendon goes by the cuboid bone and creates some irritation there. Sometimes it's hard to differentiate between the two. Sometimes they're both happening.
So we've mentioned how we see this as more of a compensatory type of injury, but it can also be an acute injury as well. So working with ballet dancers, for example, we've seen a number of peroneal type injuries, more acute type injuries, just from being on point, and some of the explosive maneuvers that they go through their feet and landing can sometimes cause more of an acute type injury here. Other sports such as soccer or football with sharp cutting side to side can sometimes place a lot of demand into these tendons and can be more of an acute type of injury. But what we'll go through is an exam of the foot and what we look for in patients who are experiencing pain on the outside part of their foot and ankle area, and we'll point out some of the risk factors and some of the causative factors of peroneal tendinopathy. So with peroneal tendinopathy, most patients will feel pain more on the outside part of their heel, ankle area, may have pain that comes all the way up towards the side of the lower leg. The peroneal muscles, peroneus longus, peroneus brevis, they originate on the outer part of the leg here and wrap down. One of them inserts into the outside part of the foot, so this may be a source of pain, and it's an area that we want to investigate, especially in acute type injuries. And then the other tendon will run underneath all the way towards the bottom of the foot, towards the big toe, and that will help with stabilization and depression of the big toe. So again, a lot of pain is mostly felt on this part of the outside part of the heel and ankle. Sometimes we'll notice a little bit of swelling around the sheaths of the tendons, and that will be an area that we'll want to work on and try to get some of the swelling out to improve that motion. Now, if these muscles are really stiff, sometimes patients will complain of popping around their ankle, and in some cases, while we're doing the evaluation, actually just moving the ankle through various ranges of motion, we can see those peroneal muscles popping over the bone. That's a sign of some tightness in the muscles and previous injury to the area that we want to, again, look at and kind of see if we can improve the flexibility of that area. And then, like we said in the intro, many times we see this as a compensatory type injury. So if a patient has injury to the inside part of their foot or shin splint type pain coming down here, that oftentimes they're hesitant in pushing and putting pressure through this portion of their foot. So what naturally ends up happening is that they load more on the outside part of the foot, which then will create a lot more loading and just chronic constant tension along the outside part, which is then going to pull into those tendons against the bone there and become quite painful. Other areas that we'll look at is the big toe and the arches. So often people who have high arches or if they have real stiff arches that don't move very well, they're going to have a more difficult time getting to the inside portion of their foot, which then will load more on the outside part, loading up those peroneal muscles. And then when we look at the big toe, we want to look for a couple different things. We want to see the alignment. We want to check to see if there's any bunion type deformity, which will tell us that they're having some challenges with proper flexion and extension of the big toe joint, which then could cause some abnormal loading to the outside part of the foot. One of the conditions that we see sometimes is what's called hallux limitus, when we apply a load to the bottom portion of the big toe and we test its flexibility, that it has a very challenging time getting into full extension. So that's something that we want to look for and address if someone's coming in with peroneal tendinopathy. Plantar flexed first ray is another condition that we look at, to where some people are born with this type of presentation where the big toe joint actually is depressed and lower down compared to the other toes of the foot. And so when that happens, when we are in a weight bearing position, the big toe joint gets pressed upward and then it gets jammed up, which makes it very challenging to get through that full extension of the big toe. And then that loads more the outer half of the foot, which then can cause that peroneal tendonitis or peroneal tendinopathy.
So we're going to go over a couple of different treatment options for peroneal tendonitis or tendinopathy. So one of the most common things we want to do is loosen up the tight muscle through here, or we want to stimulate the tendon, especially with tendinosis, which means it's been around for a long time and it just is stuck in a poor healing state. We want to bring blood flow to it and stimulate the tissue to give your body a second chance to heal it. So the biggest thing we'll do, a couple techniques, active release technique, we use our hands on, we dig into tight muscles. So in this position, I'm going to dig into this muscle here, and then we're going to stretch up and in to create some tension through it and relax. And we'll do that all up and down the muscles up to the fibular head, which is up in here. Pretty deep pressure. It's usually on the edge of patient tolerance. Hurts during, but then hopefully it'll feel better after. Another spot sometimes that will work is through the bottom of the foot where the tendon is. So that would be through here. Same kind of idea. I get the foot to flex and go inward while I work that tendon. Another type of treatment we'll use is we'll use some instruments to massage through the tendon. This is going to be more down through the tendon, kind of around the ankle here. Again, trying to stimulate the tissue so your body gets a chance to try to heal it again. So you use a little bit of lotion along the tendon. The tendon starts about here. From here up, it's mostly muscle. From here down, it's mostly the tendons. One of the tendons comes down to the side of the foot here into your fifth metatarsal, which is this little bump here. And another one comes along the bottom of the foot. So we're going to use this tool through here. You'll see a little bit of redness accumulating there. Sometimes you get a little bit of bruising. Again, we're trying to stimulate blood flow, trying to encourage the body to heal that area. So that's all normal and expected. Should be to the patient's tolerance. Should hurt good, not more than that. We'll usually do this for about 5 or 10 minutes, depending on what the patient needs. Just a quick sampling of it right now. Around the tendon, sometimes we go a little bit lighter because the bones are right there. But again, you'll see a little bit of redness developing, just like that. Another condition that comes with peroneal tendonitis sometimes called cuboid syndrome. So that's going to be some pain around here. With that, the joint between this bone and the cuboid, so this is your fifth metatarsal, fourth metatarsal, and the cuboid there, they kind of sit together. Sometimes you get some pain right through this joint and this bone. A lot of times when you land, it just feels painful, feels stuck. Some patients describe it that way. So one thing we'll do for that is do an adjustment or a manipulation through the foot to try to pop it and hopefully relieve some of the pressure. So for that, we'll grab the foot here.
Foam rolling is a really easy exercise to help loosen up some of the tight muscles of the peronei. So for this one, most people are used to doing their calves, so they'll spend time just on the back side of their leg. But to really address the peroneal muscles, because they're more on the outside portion of the lower limb, is that we need to get in a side position here to where we're really rolling into those portions of the muscle. And so Kevin's already demonstrating kind of a tripod position where you can vary the weight really easily while massaging out the peroneal muscles. But if you want a real intense massage, then you can stack the other leg on top, really try to get the weight on top of it. And anytime you find a real sore portion of the muscle, just try to stop into it, hold it for about 20-30 seconds. You can take your ankle through some range of motion. You can do some very small oscillations into that tight part of the tissue. What you don't want to do is just quickly go up and down, that you really want to spend the time and focus into those areas. If you don't have a foam roller, the hand massager, the stick, or this is the TheraBand version, you can use that to help loosen up the peroneal muscles in a seated position. So just angle the leg to where then you can push in, find those sore points, and really work into those tissues. And again, if you find a real focal spot, just try to hang out there and try to knead into it, do some figure eights and do whatever you can just to apply a little bit more pressure. One of the first exercises that we can go over with patients is just a simple resistance band around the outside part of the foot. So if our goal is to try to get a little bit more stimulation to the peroneal muscles, just wrap the band around the outer part of the foot, anchor it down with the opposite side, and then you're going to go through the full range of motion. So bringing the foot down and out, bringing the foot back up and in, and just go nice and slow in and out of those motions to create some tension. And after bands, then you can progress to more of a standing, more weight-bearing position. So in a standing position, we can put a loop band around the outside part of the feet. We're gonna have the patient just start walking side to side. So it forces those muscles to work a little bit harder on the outside part of the leg as we're going through these side steps. Also get some glute recruitment, and we get some stabilization through the arch. Now, another way you can do it is walking forward and backward, keeping that pressure out on the outside part of the feet. Good. So again, just trying to get a little bit more dynamic with this motion while applying load to the peroneal tendons. An exercise that is shown to be effective for different types of tendinopathies is eccentric loading to the tendon. So what we'll do here is a simple calf raise, except we're putting a ball in between the ankles. So the main focus of this exercise is to have the patient press their ankles in towards each other against the ball while going up. And he should feel just a slight more contraction on the outer portion of the lower leg, so getting into those peroneal muscles. Some pain when doing this type of exercise is okay. We are challenging the injured area, so a little bit of discomfort is fine. We want to work through that. And as patients get accustomed to it on flat ground, we'll have them do it off of a step. We'll try to get as much range of motion out of it as we can while under load. With peroneal tendinopathy being more of a compensatory type injury, that we may get into some other exercises with patients as well. So we want to look at their glute function, how well they're stabilizing in their hip and their core. That can help everything going downstream. We want to look at their calf strength and just see if they have the endurance or they have the explosiveness that they may need for whatever activity or sport that they're doing, so those peroneal tendons aren't getting overused. So it just really depends on the patient, and we're going to look at the whole body to try to see what might be going on so we can help deload those peroneal muscles.